Hello, my name is Adam. This is my BSN225 Subq remediation video. For this I need a few things: my pretend patient pad, my syringe and needle. In this case it's going to be a 25 gauge 5/8 inch. You can have 1/2 inch to 5/8 inch, and then 25 to 27 gauge. And then this is a milliliter syringe as well. Some gloves, alcohol, and a gauze for the patient, something for hand hygiene, and then my multi-dose vial. In this case, we're going to pretend that this is heparin. So I verified my provider's orders in the MAR, and I'm going to want to just kind of make sure that I'm aware of the 6 patient rights of medication administration, which is the right patient, the right time, the right medication, the right dosage, the right route, and the right documentation. In this case, the order is going to be for heparin 1,000 units, and the given amount is going to be heparin 10,000 per 10 milliliters. So if you divide that by 10, you get 1,000, and so 1 milliliter would be 1,000 units. So we'll use this entire syringe. So we know that we've got all our supplies. We're going to go into our patient's room, knock on the door, check for privacy, and verify their name and date of birth. Make sure that they don't have any allergies to medications or anything in that regard, and then explain to them what we're doing here. In this case, we're going to be administering a subcutaneous heparin dose, and then this is going to be for a blood thinning agent. This is an anticoagulant. I want to explain them the side effects, which could be dizziness, lightheadedness. You might feel, if you bleed, you might be bleeding for a prolonged period of time, so make sure you're letting me know about things like that. Also, make sure that that administration site is looking okay. Anytime you inject anything, you have an increased risk for infection. If they have any questions, this would be the time to ask and address those. In this case, my patient does not have any questions. My injection site for subcutaneous for this one's going to be in the abdominal area. You can also do in the fattier part of the behind the back, like the deltoid of the arm. So we're going to do our hand hygiene. Get on started with this injection. And then for this case, we're just going to pretend that the patient's, this little pad's going to be like right here in their abdomen. Okay, and then what I want to do first is just alcohol swab the top of the multi-dose vial, and I want to also check if it was potentially expired or not, because typically these multi-dose ones will have a expiration and opened date on the packaging. Should. And then just verifying again my patient's identification and my order on the MAR, which is indeed 1,000 units. So I'm going to inject some air into my syringe here, and I'm going to inject the whole milliliter, and then I'm going to make sure that I got all this on camera this time. Inject my air, and then I'm going to tip this upside down and kind of let pressure help me out here. I want to just inspect for any bubbles, give that a quick tap, make sure that there's no air in there, and then I just want to let y'all see what we've got going on here. There you go, hopefully you can see that. And then what I want to do is I'll come with my patient and I'll sanitize them. And I'm just going to make sure that you guys actually can see it this time. Now it's going to be just my verbalization, since it's kind of not on an actual model this time around, but like I was saying, this could be in either the back of the arm or the abdominal area. In this case, we're going to just pretend that this is right here. So I've used the sanitization, the alcohol on them. It's going to go at a 45-degree angle into their skin. So you're going to feel a slight bee sting here with this heparin. And then you would administer at that 45-degree angle. And pull out, and then if we have any blood, and then we want to go ahead and cap until we hear the click right there, and then we would dispose of this in a sharps container and use a little bit of that gauze on the patient. Make sure that they're doing okay, feeling right. If they wouldn't feel dizzy instantly from the heparin shot, but making sure that they were feeling okay, getting back into bed, things like that. Disposing of our gloves and our utensils, using hand hygiene again, and I want to make sure that I'm properly documenting the administration of that medication because of the 6 patient rights of medication administration. Thank you very much.